glad that you've joined us. I'm coming from my home office, and it's a pleasure to be part of this. Someday soon we'll be back together face to face, but thank you for joining us virtually. We think we have a great lineup today. We know we do, and we're really happy that you could participate. As I always do at the beginning, I really want to acknowledge our partnership with the Small Business Development Center and thank our sponsors for this lunch, and that are also our annual sponsors of the Chamber. So if I can just mention those, please. America First Credit Union and the Bank of Utah, Cache Valley Electric, Cache Valley Home Builders Association, the Cache Valley Media Group, Alta Bank, and Rocky Mountain Power. Also our Chamber Board of Governors, Autonomous Solutions, the Bullock Agency, Cache Valley Bank, Campbell Scientific, Wilson Motor, and Century West. I know I usually have all of our board of directors stand and get a round of applause, but I'll just have to give them a virtual round of applause. And thank you for supporting us at the Chamber and the job that you do. Also want to thank our Chamber ambassadors. They are really the face of the Chamber. Right now, we haven't been out to do some ribbon cuttings, but we do have a virtual ribbon cutting coming up. We'll see how that works. We think that we're going to be able to have the Greater Cache Valley Economic Summit on June the 24th. We'd like you to save that date. We're right now working on a way to do a mixture of in-person and a virtual event, and we're pretty excited about how we're going to do it. So stay tuned. We're going to be working closely with the Riverwoods Conference Center and our Bear River Health Department to make sure that if we do in-person events, that we are following all the guidelines and helping people feel safe, but also being able to get back together and take advantage of a lot of really good information that will help you going forward through this tumultuous time for all of the businesses. It's my pleasure. Now I'm going to turn the time, to Warren. Warren's going to announce and tell you just a little bit about our new members that we've had join the Chamber in the last little bit. Warren?
Yes, welcome to all of the members, current and new members. Usually we have a new member orientation. We're hoping to get back to that as of next month, if all goes well with some good social distancing and masks. And we usually have the new members get up and talk. We won't be able to do that today, but I will announce their names. We have Richard Reeves with Birch Creek Equine Dentistry up in Smithfield. We have Rex Polanis with Drawn In Media, LLC. Mike Gillenskog with Larson Fire Apparatus, Inc. Tony Peterson with The Joint Chiropractic. Dave Whitbeck with Zytronics Research and Design. And Mike Weber with Today P&D Inc. We welcome all of you, and we will give you a chance in a future leadership lunch that's in person to actually speak with all of us and introduce yourself and give your 1 minute pitch about what you do and why you do it. And thank you so much for joining the Chamber. We think it's so important to be a part of this organization, especially during this crazy time of COVID-19. Thank you, Jamie.
Yes. And thank you, Warren, for all the information that you have been sending out during COVID. I know as a Chamber member, you have been receiving our exclusive updates, and Warren's done a really good job of trying to funnel and channel and choose that information that he thinks everybody should need. And we understand that you don't need all of it every day and we have put it on our website. So we encourage you to check out thecashchamber.com to see any information that you're concerned about, and feel free to call us. Our numbers, we have always been open. Our numbers have been available. Somebody's answered the phone through the entire pandemic time. So I need to thank my staff for really stepping up during this time. It's my opportunity now to introduce Jared Ripplinger, and I am sorry that I just had an interruption. Pardon me, please forgive me. Jared Ripplinger is a partner in the CPA firm of Cook, Martin and Poulsen. Has been working in the industry for over 19 years. He has a bachelor's degree in accounting from USU and a master's of business administration also from USU. He started his career in public accounting at a CPA firm in California before returning to his roots in Cache Valley. He's a certified valuation analyst and provides a variety of business information and services from consulting to expert testimony from the IRS, compliance to strategic planning and transactions. Jared specializes in business taxation, preparation, business valuations, and assisting clients with their estate planning and trust administration needs. When Jared's not meeting with and helping clients, he enjoys spending time weightlifting, woodworking, playing sports, and spending time with his wife and their 5 children. Please welcome Jared Ripplinger for this portion of our virtual meeting. Jared.
Okay, thank you. Looks like I need to get the screen share switched over to me. Got some slides I'd like to show. So we're going to be going over the Employee Retention Credit as well as the Families First Coronavirus Response Act. So these are some business credits that are going to be applicable to a lot of you as business owners. Hopefully you can now see my screen that shows the cover page, 2020 Employee Retention Credit. Can you guys see that? Okay.
Yes.
Yes.
All right. So the Employee Retention Credit, this is probably the least known of the credits. This is a credit that is a credit of up to, well, 50% of qualifying wages for employees while they're not working because of COVID-19 related causes. What's covered in this is the wages, including the employer paid portion of health insurance. The credit is limited to $10,000 total per employee. And it's a credit that applies against the employer's portion of Social Security taxes. And I apologize, we're going to be going through a lot of these slides fairly quickly. Hopefully we'll have some chance for some Q&A at the end, but there's a lot of information in here. I just want you to at least be familiar with what the credits are and how they may apply or may not apply to your business. So for this credit, an eligible employer, there's 2 qualifications. One is that either the activity of the employer has been fully or partially suspended during the calendar quarter because of governmental limitations for COVID-19 related reasons. So we've recently seen this apply to restaurants and hair salons and other service industries where they've been shut down completely or operating at a much more limited capacity. That would be one of the limitations that would be eligible for this credit. The other eligibility is if that business experiences a 50% decline in gross receipts in their revenue in the calendar quarter versus the same calendar quarter in the previous year. So those are the 2 initial tests that you need to look at to see if this applies to your business. An important note that I put in here is that for any employer who has loan forgiveness under the PPP loans, that automatically makes you ineligible for this credit. So unfortunately, that's going to preclude a lot of employers from this credit. If you did not get a PPP loan and you're not going to, then as long as you meet these other requirements, you may still be eligible for this. And we've got a couple of different brackets of employers. The first is employers with more than 100 full-time employees. For those employers, the employee needs to be out because they cannot work for COVID-19 related reasons. If the employer has fewer than 100 employees, then all of the employee wages are eligible, whether that business is open or whether it's shut down. So it's a lot more broadly applicable for those employers with 100 or fewer employees. And it's full-time equivalents on that employee count. So those are kind of the main parameters of the employee retention credit. Again, unfortunately, a lot of employers won't be eligible for this because of the PPP loans. But this next credit or group of credits, the Families First Coronavirus Response Act, or FFCRA, this is going to apply to a lot more of you as employers. A covered employer just needs to have fewer than 500 employees. And that automatically makes you subject to the rules of this act. So this was the first act that was passed. This was passed in mid-March. The employee retention credit was part of the CARES Act, which was passed later on in the month. In order to be eligible, an employee just needs to be employed for at least 30 days. They don't have to be consecutive days. But if the employee was hired on a specific date, then all of those days count. If they worked for you as a temp employee before you hired them as a permanent employee, then it starts on the date of their employment, counting forward, and it also includes any days that they worked for you as a temp employee. So it's pretty easy for an employee to meet these qualifications. And the employee does have the responsibility to notify you as the employer that they're taking this leave. The Department of Labor has listed 5 or 6 different categories that an employee may be eligible for the leave under this act. And so we'll kind of briefly touch on each of these. And it's important to know which of these categories they fall under, because that's going to determine what the employee benefits are that they're eligible for. So again, this applies to an employee who's unable to work or telework for these following reasons. The first one is that employee is subject to a federal, state, or local quarantine or isolation order related specifically to COVID-19. So if you as an employer were affected by this directly, that doesn't necessarily mean that your individual employees were subject to one of these orders either. So you have to look at that employee specifically. So in general, that's going to be just if they were exposed, or if it's possible that they may have been exposed, so they're in a quarantine or self-isolation order. The second one is that they've been advised by a healthcare provider to self-quarantine because of COVID-19. That could be either because of suspected symptoms and they're waiting for the test results to come back, or it could be because of pre-existing conditions that that employee has that makes them more at risk, that healthcare provider may ask that employee individually to self-quarantine just so they avoid the exposure risks. The third one is an employee who is experiencing COVID-19 symptoms and they're seeking a medical diagnosis. So kind of similar to number 2, But in general, this is going to be a more short-term one, depending on the test results and the timing of that. And keep in mind that an employee could fall under multiple scenarios through 1 through 6, and they may shift which one they fall under at any given point in time. So these first 3 are important for the first class of eligibility or of benefits. And then numbers 4, 5, and 6 have a different set of benefits that they're eligible for. Number 4 is the employee is caring for an individual subject to an order under number 1 or number 2. And in this, it has to be someone that they ordinarily have responsibility in caring for. Number 5 is the employee is caring for a child whose school or place of care, so the daycare, has been closed for COVID-19 related reasons. This one applies to a lot of people because of the school closures that we've had throughout the entire state. So we've had several clients with employees taking leave under number 5, perfectly healthy and everything, but they've got to be home to take care of kids who are out of school or out of daycare. And then number 6, any kind of substantially similar condition prescribed by the Secretary of Health and Human Services. So that's kind of a catch-all. So an employee, again, they have to be unable to work or telework for one of these 6 reasons. For reasons 1, 2, and 3, so again, we're going to be referring back to that list of 6 reasons quite a bit. For those first 3 reasons, which is something that directly impacts the employee themselves, the maximum benefit under this act is $511 per day, or $5,110 total over a 2-week period. That's assuming that the employee was a full-time employee. For reasons 4, 5, or 6, where they're home because they're taking care of someone else, the employee is eligible for 2/3 of their regular pay, and it has a maximum daily amount of $200 per day, or $2,000 total over the 2-week period. So those are some important distinctions to make because it's a significantly different set of benefits that employee receives. And keep in mind that all employers with fewer than 500 employees are required to follow these for the 2-week period. For reason number 5, which is taking care of the child because of school or daycare closure, there's also an additional 10-week period on top of that 2-week sick leave that they may be eligible for. And we'll get into some specifics on that. This is eligible or available for self-employed individuals as well. For a self-employed individual, in order to get the credit, it's just a reduction against their estimated tax payments during 2020. And then it's a credit that will be claimed on your 2020 income tax return that you'll file at the end of the year. There's no way to get any kind of an advance on the credit for self-employed individuals unless you have W-2 employees that you are paying the benefits to during the year. So the eligibility for this, it's only days that are taken into consideration from April 1st through December 31st of 2020. If that last pay date cuts off at December 31st and it's paid out in January, you're still eligible there because the days that the leave happened occurred during 2020. And likewise, anyone who had sick leave during March, those days would not be eligible even if they met all the other requirements, and even if that pay date was in April. So it really is just the actual days that the employee is out starting April 1st through the end of this year. We're going to skip through a lot of this just in the sake of time. Okay, so how do you get this credit as the employer? There's a couple of ways that you can apply this credit. The first way is that you can actually reduce your payroll tax deposits, at least your federal payroll tax deposits. For most of you, it's going to be your 941 deposits that you make. Probably a lot of you, it's going to be on a monthly or quarterly basis, and that Form 941 gets filed as part of your payroll forms on a quarterly basis. So you can actually reduce the your 941 deposits by the amount of eligible credit because of the wages that you've paid out to these employees on leave. And if for some reason you don't have enough federal payroll deposits to offset the wages that you've paid out under this act, there's a Form 7200 that the IRS has released, and you can actually request an advance payment of those employer credits. So you can get that paid to you by the Treasury to cover that deficiency that your payroll taxes don't cover. We'll just really quickly go over the form. It's a simple one-page form, has very brief instructions. The top section is just your basic business information and identification and an indication of which quarter you're applying for this for. This middle section, part one, is just an indication of what type of payroll form you file. For most businesses, it's under A1, it's Form 941. But depending on your industry or your frequency of payroll filing requirements, you may fall under one of the other ones. In part two, this is where all three of these credits that we've discussed can be claimed here. So that employee retention credit, that's the one where you only get if you don't have a PPP loan. Number two is the qualified sick leave. So that's the 2 weeks of required leave that you're required to pay for all eligible employees. And then number three is the family leave, which is the additional 10 weeks if that employee is home because of a school or daycare closure. So all of those get reconciled here to the amounts that you've deposited for your 941 taxes. And then the bottom part is just your basic signature and that you're signing under penalties of perjury, that you're reporting correct information. So we'll go through a couple examples real quickly here. So example one, we've got an eligible employer who pays out $5,000 in sick leave during the quarter. And normally they would be depositing $8,000 in payroll taxes. So they're able to use 500 of that 8,000 and just divert it toward those sick leave wages to the employees. And then that balance of 3,000 is what gets deposited on the next regular payroll deposit date. In example two, we've got the same situation, but the employer has paid out $10,000 in sick leave. So it exceeds what their payroll deposits are. And so that balance of the 2,000, they can file that Form 7200 and get an advance payment of that credit. The IRS expects the turnaround time on that advance payment to be within 2 weeks. And so they really have a focus on making sure that you receive that in a timely manner. For self-employed individuals, other than payroll employees that you're paying, you just reduce your estimated tax payments for the amount of eligible credit. We'll skip some of this compliance, but there are DOL rules. The Department of Labor requires that you post a poster so the employees have notice of their eligibility and their rights under this act. One other thing I want to point out is that for employers with fewer than 50 employees, you may be able to qualify for an exemption from that additional 10 weeks of family leave. You have to keep some documentation to show that in complying with that, it would jeopardize the viability of your business. And the Department of Labor has listed 3 specific situations where they say it's okay to qualify for this exemption. Now, there may be others that qualify, but these are the only 3 that the Department of Labor has specifically authorized. The first one is the expenses and financial obligations exceed the business revenues. So you're not able to continue the business even at a reduced capacity. The second one is that the employee requesting the leave has specialized skills, knowledge of the business, or responsibilities that would substantially put at risk your business. And then the third is you don't have sufficient workers who are able and willing and qualified, or who have time that's available to perform the labor or services provided by the employee requesting leave. So if you meet one of those 3 requirements, and if you have fewer than 50 employees, then you can deny that request for the additional 10 weeks of leave. You can't deny the request for the first 2 weeks. All employees are eligible as long as they meet the other eligibility requirements, but you can deny the additional 10 weeks. The other thing with the additional 10 weeks is that you can require that they use their paid time off or their sick leave before you pay under this act. And so anyway, there are some safeguards for you as an employer if you meet those requirements. To the extent that wages are eligible for any of these credits, you do have to reduce your PPP loan eligible wages by any credits that you receive under this act. So just keep that in mind as you're deciding which provision to apply. If you've got a PPP loan and you want to use the loan purely for wages because it'll be eligible for forgiveness, you can do that during your 8-week period. And then once the loan forgiveness has been applied for, you can then apply these sick leave times and credits toward your wages that are paid later on in the year. So you can ladder these on timing. You just can't count the same wages for both the credit and for the loan forgiveness. I think that's probably all we have time for. I think we got through most of the detail. There are some other nuances in here. And if you have specific questions on this, I'd be happy to discuss those with you offline. But I think we've got the Lieutenant Governor here, so I don't want to take up any of his time.
Thank you, Jared. Would you be willing to share your slides with the people that registered today?
Absolutely. I will email them to you, or
Okay.
I've got Jason's email, so I'll
Yeah.
email them to Jason, and then he can
Yeah.
make sure anyone who wants a copy of the slides can get a full copy.
We understand this is complicated and, you know, very detailed. So what we'll do is we're also recording this today. So anybody who registered can get a recording and a copy of your slides. Thank you, Jared from Cook Martin Poulsen. I think I forgot to mention that you were from Cook Martin Poulsen, and we appreciate today so much that you've given your time to explain this and in complicated and important information. It's my privilege now to introduce our Lieutenant Governor. Spencer J. Cox is Utah's 8th Lieutenant Governor, and he's from Fairview, Utah, where he currently resides with his wife, Abby, and their 4 children. He's a graduate of Snow College and USU. I have to say that. Woo! Thanks for coming to your old stomping grounds today. I'll just put a little side note in. He also went to Washington and Lee Law School. He formerly practiced law and was the general counsel of Centricom. He served as a city councilman and a mayor of Fairview before he went on to be a county commissioner in Sanpete County and then in the Utah House of Representatives. So I feel like that just really qualifies the lieutenant governor for his current role. He is by statute the chief election officer of the state and the liaison between the governor and the legislature. He travels extensively throughout the state, and we've seen him here a few times, and we're glad to have him back. Supporting economic development, which is one of the reasons I've had quite a few interactions with the Lieutenant Governor as I serve as Economic Development Director here. So in addition to my regular day job, he's committed to strengthening families, transforming education, increasing voter participation, utilizing modern technologies, promoting healthy living, and empowering the homeless and the impoverished. Please welcome our current Lieutenant Governor, Spencer Cox, to our meeting today. Take it away.
Thank you so much to everyone on this call for the invitation. My only regret is that I'm not actually in Cache Valley today and that we can't be there in person, but I hope to be back again soon. Our time in Cache Valley was one of the choicest experiences of our life. My wife and I, I've told the story before, but we both grew up in Sanpete County. I grew up in Fairview. She was in Mount Pleasant. We went to high school together. After I got back from a mission, she agreed to marry me, and I said, this is great, we'll get married and go to BYU. And she said, I'll marry you, I'll be in Logan, and if you want to marry me, so will you. And it was the best decision I ever made, both the marrying her and the going to Logan piece of that. We are proud Aggies. Just by note, there are 10 kids in her family, and all 10 of those kids are Aggies, and so are all of their spouses. There are 27 degrees in her immediate family from Utah State. So really awesome. We still have family there. I actually have family in Lewiston. And so we just, my entire life, Cache Valley has been a very special place for us, and living in Logan was amazing. Now, I've been invited to talk to you a little bit about the coronavirus response here in the state of Utah. It doesn't seem like there's anything else for us to talk about these days, and so I'm happy to do that. I want to make sure and leave time to answer your questions, and so I'll kind of go through a little bit of how we got where we are, and maybe give you a little behind the scenes perspective that I hope will be helpful to you as you try to understand where we are and where we're going. So I've got to go back to early March. The President of the United States, as we started to see cases of the coronavirus here in our country, appointed the Vice President to run the federal task force. And the governor looked at that model and said, I think that's what we need to do here in the state. And so he asked me to put together a group, a task force here in the state of Utah, our coronavirus response task force. And we did that. We included people from from lots of different walks of life. Of course, public health was represented. Dr. Angela Dunn, who has kind of become a little bit of a household face and named through all of this, the state's epidemiologist representing public health as well as local public health. We had representation from some major hospitals in the state, IHC. The University of Utah is the research institution here. We had representation from education and from the faith-based communities, representation from the Church of Jesus Christ of Latter-day Saints and others, those representing our homeless communities. We had the business community represented through Derek Miller and the Salt Lake Chamber of Commerce working on our economic response, and several others. And we all came together. This was on March 2nd. We brought experts in, former Governor Mike Leavitt, who had also served at the federal level, dealing specifically with pandemic response, and we started kind of putting plans together. What would this look like if we saw it here? And we were formulating that. And then things happened very, very quickly. You'll remember the timelines a little bit. So, some of the major things, we were in the middle of a legislative session. And in fact, we were at the end of the legislative session. The legislative session ended on Thursday night at midnight. And I believe it was basically, most of this went down on Tuesday, kind of Wednesday timeframe of that week. But there were some major announcements. We had already had a positive case here in the state of Utah, and then we had a couple more, and then that day, Wednesday day, we had an announcement from the predominant church in our state that they were going to do their annual conference, semi-annual general conference was going to be held remotely, and that was kind of a shock, I think, to a lot of people, knowing that big event was coming up. And then that night, I got a call from Steve Starks, the head of the Utah Jazz, who said, "Hey, we have a problem. Rudy Gobert just tested positive," and I think he was just the 4th case in the state of Utah. They were in Oklahoma City at the time. That night was one of the longest nights of my life until the next night and the night after that, and all the nights for a couple months. But the NBA ended up canceling the season. By the time that night was over, Donovan Mitchell had also tested positive. He was the 5th case in the state of Utah, and that's when everything changed, and the whole world kind of realized, okay, this is bigger than we thought. It's moving much more rapidly than we expected. And the biggest problem in all of this was a lack of information. Having to make decisions when you don't have good information is the worst possible decision making. But because of mistakes that happened, unfortunately, at the federal level, when it comes to testing, we did not have testing capacity here in our country. This has been written about. I won't go into too many details, but the WHO had developed a test that was being used in China and in Europe and other places. And the CDC here in the United States decided that we were going to do our own test. They developed the test. They sent that out in February, and then the test failed. There was a fatal flaw in the test, and they had to basically start over, which meant that we were unprepared, and we did not have testing capacity here in our country. When we started getting tests, getting positive results back here in the state of Utah, we only had the ability to do about 75 tests a day. And so we had to reserve all of our testing capacity for those who were in the most serious condition to protect our frontline healthcare workers, which meant we could really only test people once they got into the hospital. We started working with ARUP at the University of Utah, which is one of the 4 largest test labs in the country, and they started to ramp up testing capacity. Then IHC, the state lab, was able to ramp up a little bit. Then we got the private sector involved with Test Utah to increase using lab capacity at Timpanogos Hospital in Utah County. And so as we were looking early, okay, how are we going to do this? Because now the whole world is shutting down. What is Utah's response going to be? We knew that mass gatherings were a real problem. That was where you could have these super spreader events that have been well documented, and so that was where we moved first. And in so doing, the idea was, okay, we need to buy time to figure out what the response is going to be to ramp up testing. We also started looking at other nations that had had a successful response. And it became very clear to us and to most places that South Korea was the best model of all the other countries in their response. And basically that response comes down to two very important critical pieces of any sort of epidemiology or pandemic. And that is testing and contact tracing. So first of all, you have to know where the disease is and where it's spreading. And that's where testing comes in. It's testing. It was always the most important piece of this. And unfortunately, the piece that our country was the least prepared for. The second piece of this is the contact tracing. Once someone tests positive, then you isolate that person. As we learn more, again, this novel disease, part of the problem was we didn't know how it was spread. Early on, we were told for a long time that it really couldn't be spread asymptomatically, and you had to have symptoms to do it. Now, unfortunately, and this is bad news, is that we know that maybe as much as half of the spread, 40+% is likely through asymptomatic spread, which makes it much more difficult to contain. However, so that's where we were starting from. And so then contact tracing is someone tests positive, then you sit down with that person, you isolate that person, and you figure out everyone they've been in contact with over the past few days, and then you isolate those people as well. The idea is, again, if we can prevent this from having incremental spread. When this disease first started in the state of Utah, every person that got infected or tested positive was infecting 3 to 4 other people, sometimes more. With that kind of spread, you see the numbers, the damning numbers that we saw in places like Italy and New York, and so we wanted to avoid that. Through contact tracing, you have the ability to do that and to bring it down. And so we started putting everything we had into testing. And I'm so proud of our teams who stood up and ramped things up. For now, the rest of the country is finally catching up with us. But all through April and into May, we were 4th in the nation for testing per capita. And when I say that, it doesn't even put it into perspective, because the only ones that were ahead of us were states with major outbreaks where the federal government had put all of their resources. So like New York was ahead of us, for example. Those were the states. To have a smaller state like Utah being in the top 5 in testing was just unheard of. And so that allowed us to flatten the curve that you heard so much about, to not overwhelm our healthcare system. However, there were trials at every step of the way. It's not just to say we had the test. Once we got the test, we ran out of the reagent, the chemicals that you need to process the test. Because again, remember, every country and every state is fighting over the same materials. So we ran out of reagent, and then we're trying to find reagent, and then we started running out of the swabs that look like the giant Q-tips, but they're not Q-tips. Otherwise, we wouldn't have ran out. But these specialty swabs that are used, so we started running out of those. It was just one problem after another, and it took all of the resources that we had as a state to do this. One story that's been written about running out of swabs. Every state was running out of swabs. Nations were running out of swabs, and you can't keep testing and you fall behind if you don't have the swabs. We had literally just hours of swabs left. We found through Senator Romney's office someone in, and I don't even want to know who these people were, someone in Chicago who had a truckload of swabs, and we paid 10 times what we would normally pay for swabs, but we had to get them here. We actually sent a plane out to meet the truck to make sure that they had on the truck what they said they had on the truck. It was that kind of clandestine work that was going on, and this was happening all across the country. We also had a shortage of PPE that you've heard so much about: the masks, the gowns, the face shields, the gloves that our frontline workers needed. And again, China is where most of this stuff was made. Everything was shutting down, and so we would have a load, we would have a plane load of equipment coming to Utah from China, and then all of a sudden it disappeared and it went somewhere else, and we don't know who. Someone outbid us, someone confiscated it, we would never find out, and really struggling during all of this to get things done. But I'm so proud of our team and the way things stepped up. Let me fast forward a little bit to where we are today. Again, we have more testing capacity per capita than just about anywhere else in the country. In fact, there's a bunch of capacity that we're not using right now, but we're starting to use more of that, and that's really important again as we go on the offensive. Now we can start testing meat packing plants, all of the workers. We can start testing all of the employees and patients who are in our long-term care facilities. About half of the deaths in Utah, we have just over 80 deaths, I believe now. About half of those have come from our long-term care facility. So we can start using this testing capacity again to be more aggressive to save lives. We also have more contact tracing per capita than anywhere else in the country. We have 1,200 people now. In a normal year, we would have less than 40 that are involved in contact tracing for things like the measles and others at our local health departments. Now we have over 1,200 people engaged in, when someone tests positive, sitting down, figure out who they've been in contact with, reaching out to those people, getting them tested, and trying to, again, take a surgical approach to isolate this. Now let's talk about the economy. We knew, and we've seen this everywhere in the country, that the economic impacts of this would just be devastating. And so this concept of shutting everything down was just very difficult. How do you find balance, again, when you don't know where the disease is, when you have reports coming out of places like New York and Italy and others where hospitals are being overwhelmed? How do you respond to that? And so we tried to take a much more localized approach. We were one of only 7 states that didn't do a statewide lockdown. We have always been as cautious as we can possibly be, again, with experts weighing in. That was a very difficult decision. I can tell you the governor was under a tremendous amount of pressure to do a statewide lockdown. Every other state was doing it. We were one of the few that, Idaho did it. Everyone was doing it. Why aren't we doing it? And the accusations are you're either killing people or you're killing their livelihoods, and that's a terrible choice to have to make. And by the way, a false choice, and something we can address. But the governor rejected that, and we were fortunate enough not to be able to do that. New report came out today that said that the state of Utah has the 5th fewest restrictions of any state. There are 45 states that have more restrictions on economic activity than the state of Utah. So again, I think that's something that we can be very proud of. At the same time, our response and the response of Utahns has just been overwhelmingly amazing. We have, not only have we flattened the curve, but we have one of the lowest mortality rates in the country. We have, as I mentioned, one of the highest testing rates in the country. Our ratio of positive tests to overall testing, the WHO has said to be able to open things up, you need to be under 10. We never got higher than 6, which is just remarkable. 6% of positive tests to ratio to overall tests. Our rate, total rate is about 4.2%. We've been as low some days as 2.5%, which is, again, just remarkable. We have hospital capacity. We're following it very closely. We have capacity in our ICU. We have ICU beds available. We've expanded capacity if there is a surge or we see an increase in the fall. We're better prepared for that. The supply chains have started to open back up. We have PPE. We're really banking things, getting ready for whatever's coming next. Now, our unemployment rate is going to be, again, just tragic and devastating, but there are some signs of hope. Some good news, we don't have the official unemployment rate for the month of April. That will be released on Friday. However, the National Chamber of Commerce believes that we are one of only 2 states with an unemployment rate below 10%. Coming out of the month of April, again, which is something that Utahns and the business community should be very proud of. It's representative of a tremendous amount of hard work, not just now, but over the past 10 years, as we have been the fastest growing economy in the country and the most diverse economy, which puts us in a position to come out of this better than any other state. This week, we may be the first state where the number of people going back to work is actually exceeding the number of unemployment claims coming in. So that is, again, very, very good news, a sliver of light in a very dark economic time for our state and for our country and for the world as a whole. Now we know we have a long ways to go to come back, but we also know that the history of Utah is a history of doing hard things. And as we have opened things back up, we continue to take a much more localized approach. It's something I've been pushing really hard for. We are not a one-size-fits-all state, and the way the disease is spreading is very different in different locations. Now that we have 12 mobile teams, testing teams, we can do this even better. We can do things ultimately by zip code is what we want to do. We have some hot spots in West Valley that are still closed down. Of course, in southeastern Utah, where the tribes are, there's been some significant outbreaks there, very tragic. But we are able to attack those now on a localized basis, which allows the rest of us, especially in rural Utah. I still live in Fairview. I drive 200 miles round trip every day. Tell people we've been social isolating for 160 years. It's just the way we do things in rural Utah, and we're okay. And so helping people on the Wasatch Front understand that it is different in Cache Valley, it is different in central and southern Utah, and making sure we have the leeway in policies coming out that allow us to do that. So in a very quick nutshell, I could spend a couple hours talking about all of this, but that's where we are. And I would love to answer some questions if you have any.
I think some of the questions we might have, well, one question is, when are we going to go to green? And you know that, like you just said, Cache County, the Bear River Health Department area, which reaches into Rich and Box Elder, our numbers have been low. So how are you going to, maybe tell us how you're going to assess and move to the next level? Tell us a little bit about what that process looks like.
Absolutely, thank you. So as most of you know, the entire state, with some exceptions that I've mentioned, the rest of the state moved to yellow last week, and so we some of this, as this changed, one of the things I didn't mention was there was a special session held by the legislature, and they formalized a process that kind of takes it out of our task force into a different sphere. So we don't have a lot of influence over that decision, moving from red to orange, orange to yellow, and yellow to green. That is made up. There is an economic and a health and economic commission that was put together, made up of some legislative leadership, as well as some public health, a couple of our hospital chains, and some economic advisors who are on that team as well. And so the way that this will work and continue to work going forward, and the way we did it here, is a recommendation comes from the local levels. If they want to move from one color to another, they have to have data to justify that move, and then they make that recommendation. The local health department, in conjunction with elected leadership, makes the recommendation to the state health department. State health department then evaluates that data and submits it to the commission. The commission then makes a recommendation to the governor, who ultimately makes the decision. But when it comes to actually what they're looking at, it's pretty simple. First of all, you have to have a little bit of time in one color before you move to the next to see what happens, to make sure that we're not overwhelming our hospitals, that we don't have a significant outbreak. What we do know about this disease is that there is a latency period of up to 2 weeks before you know whether it can take 2 weeks from exposure to actually having symptoms to know if you've had the disease, if you get symptoms at all. But so that 2 week period, you'll notice that most states, most countries, state of Utah has been the same too. We've kind of done everything in 2 week increments just to see if the last thing we did worked. It would be nice to know immediately, but we don't have that ability. So really, it is incumbent on all of us as Utahns. If we're able to do the things that healthcare professionals are recommending, if we wash our hands, if we keep a safe distance between other people, if we wear masks in public, if we do all of those things, and we can prevent the spread of this, we can move to green fairly quickly. We talked to one of our economic advisors today, who said that she would love to see parts of the state to start moving in a couple of weeks, with the entire state moving in a month. We do know that there is some seasonality to this disease. We don't know how much. We'll figure that out. The warmer weather should help. We know that being outside is always better than being inside. So those are important things to take into account. Obviously, the most helpful thing will be treatments. and ultimately a vaccine. And those are coming. They're coming more quickly than many people anticipated. We had a great call with the president and vice president yesterday, in which we got an update from Dr. Fauci on one of the first vaccines that has gone through its first phase of human trial, and it came out very, very positive. In fact, lower doses of the vaccine produced antibodies that were all that were needed or maybe needed compared to the even higher doses, which is great news, because if there's a lower dosage, it means they can produce more of it more quickly. One of the really cool things that is happening right now, and it's a little bit of a moonshot, but I love that they're thinking this way and taking it, is that they are already ramping up production facilities of these potential vaccines, even though they don't know if the vaccines are going to be successful or not. But it's worth it to spend the money, because if it is successful, then we have lots of production. We can produce millions of doses instead of having to wait a year as you would normally do. So that is very positive news. We're hopeful that we will get portions of the state to green very, very soon in the coming months. We are worried about a spike in the fall. Every pandemic tends to see that type of a thing. But again, we're much better prepared for a potential spike in the fall than we were for March and April.
I guess my question, another follow-up on that, is that, you know, me as a leader of the chamber, I have been following the Utah Leads, you know, document that you put out like it was the Bible, and we're looking for more details when it comes to events like this event that we're going to be, that we normally would have in person. We're wondering, is there going to be some more detail and updates? And then maybe as things lapse, or if we have a lapse in the fall, will we still follow these guidelines? Is this going to be continuing?
Yeah, it will. Great question. And this is the hardest part, in that it's just impossible to think through every scenario and every potential event. So we're trying to get some, again, the group that's working on this, trying to get some very, very, very good and detailed and yet broad enough to kind of cover everybody, details about what can or should be done and how to be careful. But at the end of the day, it's going to be on all of us to try to make the best decisions we can and the most common sense decisions that we can. We do anticipate that we will be following this into the fall. Again, until there is a vaccine and some herd immunity, we will still be using this kind of color-coded. And by the way, I mean, let's be honest, we've never done anything like this, right? It's been 100 years since we've faced anything like this. We're all making this up. The experts who came up with red and orange and yellow and green, we've never gone from orange to yellow or yellow to green. That's not even a thing. It really is just kind of okay, how do we help people kind of visualize the danger that is out there? And there is another version coming out tomorrow. I'll give you just a quick preview. It won't be more detail on this. It's going to be more detail about how to protect the most vulnerable, because now we have good data in the state of Utah. What we want to do is say, okay, if we're going to live with this virus for a while, how do we protect the most people and still exacerbate in a positive way our economy, open up our economy and get back to economic activity? And the way to do that is to say, okay, this virus does not impact everyone the same. So let's protect those who have the comorbidities, those who are over the age of 65 and have underlying healthcare conditions. How do we protect them better so that everyone else can really get back to a sense of normal, whatever that is. And that's really going to be the focus of 3.0. Already working on version 4.0, which is economic stimulus, and what can we do more at the state level to explode the economy and help things grow. So that's the good news. We're happy to take recommendations. We are relying on on our local health departments to try to answer those individualized questions. The last thing I'll say is this: understanding risk is really important. And there's a blog post out there I would love to send out from a well-respected doctor on understanding risk with this virus and how to make decisions individually. Anytime we can we can limit physical activity with other people. It's just better for this to slow the spread of this disease. So, you know, my philosophy and with my staff is, do we have to all be together? And if we don't, if we can do the same thing and not putting a whole bunch of people together, that's just going to help. You know, if our interactions used to be at 100 and we take them to 75, still a lot of interactions, but fewer than we had before, that's bad for the disease. It doesn't like that. You know, this disease wants us to be together as much as possible and as close together as possible. So it doesn't mean we go to 0, but are there common sense things we can do to limit, keep our distance a little bit? And that's just going to help from overwhelming things until we can get a solution, but still have our economic activity ramp up.
Thank you so much. And if you would send a link to that blog post, we'll share that with the people who have registered for today's event. We know that your time is so valuable and that you have so many things on your plate. I was just thrilled and honored that you take the time to be with us today. So we appreciate what you've said. It's been very helpful. And I really wanted the members of my area to see, and the members of our chamber to see, what it was like to form this huge task force and to try and navigate something that's so difficult. So thank you again to Lieutenant Governor Cox. We appreciate you so much. And for everyone who joined today, thank you. And we'll be sharing the recording, the slides, and if we can get that link, that would be terrific.
Sounds good. Thanks, everyone.
Thank you.